The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.
Hello and welcome to the ASCO Guidelines podcast series brought to you by the ASCO Podcast Network, a collection of 9 programs covering a range of educational and scientific content and offering enriching insight into the world of cancer care. You can find all the shows, including this one, at asco.org/podcasts. My name is Brittany Harvey, and today we're continuing our series on the management of immune-related adverse events. I am joined by Dr. Marc Ernstoff from the National Cancer Institute in Bethesda, Maryland, author on management of immune-related adverse events in patients treated with immune checkpoint inhibitor therapy, ASCO Guideline update, and management of immune-related adverse events in patients treated with Chimeric Antigen Receptor T-cell therapy, ASCO Guideline. And today we're focusing on ocular toxicities in patients treated with immune checkpoint inhibitor therapy. Thank you for being here, Dr. Ernstoff.
Thank you, Brittany.
First, I'd like to note that ASCO takes great care in the development of its guidelines and ensuring that the ASCO conflict of interest policy is followed for each guideline. The full conflict of interest information for this guideline panel is available online with the publication of the guidelines in the Journal of Clinical Oncology. Dr. Ernstoff, do you have any relevant disclosures that are directly related to this guideline?
I have no further disclosures at this time.
Great, thank you. Then let's get into these ocular toxicities. So first, what are the immune-related ocular toxicities addressed in this guideline?
So the ocular toxicities addressed in the guidelines represent a relatively uncommon side effect of immune checkpoint inhibition and represents inflammation of all components of the eye, from the superficial component to the internal uveal component. So there is iritis, there's episcleritis, and uveitis are the ones that are usually identified by physical examination and by complaints.
Understood. Then, so let's start with what are the key recommendations for identification, evaluation, and management of uveitis and iritis?
So those are excellent questions. I think that it's important for clinicians to recognize that while most of the eye toxicities are relatively minor, low grade, and can be managed effectively, there are some that are very important to identify, particularly as they may lead to blindness, particularly uveitis or panuveitis. So identification of these symptoms and signs are important. So evaluation of the patient by asking whether there are any eye symptoms, dryness, or irritation is important in your evaluation of the patient's side effects. In addition, looking at the eye, both with a pen light, looking for any inflammatory signs, and doing a ophthalmologic examination to make sure there's no cloudiness or anything identified in the retina is important.
Great. And then furthermore, what are the key recommendations for identification, evaluation, and management of episcleritis?
So episcleritis can usually be seen by irritation in the superficial areas of the eye. It usually can be managed, if it's low grade, it can be managed with topical steroids and continuation of the immune checkpoint inhibitor. On the other hand, if it's more bothersome and not responding to topical therapy, evaluation by an ophthalmologist, potentially interruption of immune checkpoint inhibitor is important. And if it's severe, systemic steroids might be required at that time.
Great. Thank you for reviewing how to best identify and manage that particular toxicity. So then, in your view, how will these recommendations for the management of ocular toxicities impact both clinicians and patients?
So I think it's important that both from symptom management, that these many times can be managed with topical steroids and tears effectively, and that a patient's therapy can continue, which I believe is important. On the other hand, identifying areas that may be beyond the expertise of an oncologist, would require evaluation by an ophthalmologist, including a slit light examination. It is important to recognize that uveitis can have minimal symptoms and yet be more severe in its condition, requiring intervention and holding of immune checkpoint. And if really severe, grade 3 or 4, interruption and discontinuation of immune checkpoint inhibition is probably going to be required to manage the side effect. Again, if undiagnosed and untreated, it can lead to blindness. So while not, quote, life-threatening, clearly a major impact in quality of life of a patient that is preventable if identified.
Great. Thank you so much for reviewing these recommendations for the management of ocular toxicities to ensure about the quality of life of patients and the best practices for management of these toxicities. So I want to thank you for your work on these guidelines and for taking the time to speak to me today, Dr. Ernstoff.
Thank you very much, Brittany.
And thank you to all of our listeners for tuning in to the ASCO Guidelines podcast series. Stay tuned for additional episodes on the management of immune-related adverse events. To read the full guideline, go to www.asco.org/supportive-care-guidelines. You can also find many of our guidelines and interactive resources in the free ASCO Guidelines app, available in iTunes or the Google Play Store. If you have enjoyed what you've heard today, please rate and review the podcast and be sure to subscribe so you never miss an episode.